Okay kasigurista, real talk muna tayo. Imagine this. One emergency, one ICU confinement, or one unexpected critical illness. Ang malaking tanong, kaya ba ng savings mo? O ng current HMO mo? If you can give me a straight yes, I want you to focus on what I'll be sharing now. Allow me to introduce you to Medical Secure by Manulife. It's a yearly renewable health insurance plan that gives you solid protection against big and unexpected medical bills. From emergency, hospitalization hanggang critical illness procedures, may sasalo sa'yo. Now the best part? You can choose from 3 levels of protection depending on your needs and budget. May 3 annual benefit limits. May 1 million, 2.5 million, and 5 million annual benefit limit. Later, I'll be sharing you QR codes para makapag-download kayo ng sample proposal to have a visual and ma-review nyo rin yung specifics ng Medical Secure. I-share ko sa screen yung QR code later para ma-download nyo, okay? So, let's start with the basic plan. This is the 1 million pesos annual benefit limit. This is ideal for average employees or self-employed individuals who want decent coverage but are budget conscious. It covers all the essentials, room and board up to 5,000 pesos per day, professional fees, hospital charges, operating charges, lahat ng special procedures, and access to accredited value care hospitals. Even land ambulance is covered up to 3,000 pesos per ride. PET scan is covered up to 10,000 pesos. Organ transplant is covered up to 200,000 pesos. Eye laser treatment is covered up to 10% of the annual limit. Cryosurgery is covered up to 1,000 pesos per area. It also includes annual physical exam, 24/7 teleconsultation, and a life insurance benefit of 100,000 pesos. Premium for a 30-year-old is around 25,572 pesos per year. So next, let's move to the mid variant, the 2.5 million pesos annual benefit limit. Honestly, this is our bestseller. Many clients go for this because it gives that extra layer of security, especially if you have a family or if you live in urban areas where hospitalization costs can easily pile up. Room and board is covered up to 7,500 pesos per day. Other inclusions and limits are the same, land ambulance, PET scan, and other procedures. The organ transplant here is 500,000 pesos. The only difference is you now have more room to spend with the higher coverage cap. Life insurance benefit here is 250,000 pesos. For a male at age 30, the annual premium is 38,611 pesos per year. Not bad for peace of mind, right? And for those who really want maximum protection, we have the top variant, the 5 million pesos annual benefit limit. This is highly recommended for executives, business owners, or anyone who wants access to premium hospitals like St. Luke's or Makati Med without worrying about massive bills. Room and board is capped or covered up to 15,000 pesos per day. Organ transplant is up to 1 million pesos. The rest of the coverage and special procedures limits apply similarly, but now with 5 million pesos to work with. Life insurance benefit here is 500,000 pesos. For a 30-year-old male, the yearly premium is 56,700 pesos. Ang kagandahan sa Medical Secure, pwede kang mag-attach ng deductible para bumaba ang premium mo. So yung kaninang pinakita ko na premium per year, they are for full cover o ibig sabihin walang deductible. Okay, so there are 3 levels of deductible options you may attach to a Medical Secure plan. We have the 100,000 pesos, the 150,000 pesos, and 200,000 pesos. Now, you might be wondering, ano nga ba ang deductible? Basically, it means you will handle the first part of the medical bill, either gamit yung HMO mo, PhilHealth, or even out-of-pocket, bago pumasok si Medical Secure to cover the rest. And the nice part, your premium gets cheaper. You can choose a deductible, depende sa setup mo. So, super smart siya if you already have HMO coverage. Kasi para hindi ka nagbabayad ng full premium when you are already partially protected. But take note ha, if nagamit mo na yung HMO mo for outpatient consultations or labs, then na-confine ka, you'll have to shoulder muna the remaining deductible amount bago si Medical Secure mag-step in. Also, let's say na-confine ka sa hospital na hindi accredited ng HMO mo, same thing applies. You still have to pay for the first part of the bill up to the deductible. So some clients prefer to go for zero deductible to avoid the hassle and just let Medical Secure take care of everything right away. So it really depends on your setup and what you're comfortable with. Okay. Again, this works with or without HMO. Remember, this plan has no savings component. This is pure protection. Every peso goes to benefits you can actually use. Ang mahalaga, covered ka dahil emergencies or medical emergencies don't wait. Alright? So, cashless ang access mo sa value care accredited hospital and clinics, which makes your experience super hassle-free. Okay? So, ano nga ba ang role ni Value Care? Siya yung third-party administrator ni Medical Secure. They provide Medical Secure with their networks of medical facilities, physicians, and specialists, and you can double-check. Sobrang laki ng network ni Value Care. They have 1,200 accredited hospitals, including top medical centers like St. Luke's, the Medical City, and Makati Medical Center. Sa mga physicians and specialists naman, they have 20,000 accredited physicians across all specialties. So sobrang lawak, you can just Google them to check your preferred hospitals. Alright, kasigurista, ito na yung isa sa pinaka-importanting parts, yung waiting periods. So ganito siya. Yung emergencies tulad ng accidents, dengue, or rabies bite, covered ka agad as in day 1 pa lang ng plan mo. Let's say nadulas ka or any accidents na kailangan kang dalhin agad sa ER, pasok yan. Even if hindi ka na-confine after. Basta emergencies siya, kasama pa rin siya sa benefits mo. But most illnesses are covered after 30-day waiting period. Ibig sabihin, kapag nakuha mo na ang plan ngayon, na-approve ka, kailangan mo munang hintayin ng 30 days bago ka maging fully protected or covered for most common sicknesses. Now, may mga sakit na may tinatawag tayong may 12-month waiting period. Ito yung mga conditions na usually matagal na nade-develop or may history sa family, kasama rito yung hypertension, diabetes, asthma, gallstone, kidney stones, liver problems, cancers, mga conditions sa reproductive system at mga sakit sa spine or joints tulad ng arthritis or at gout. Kapag meron kang ganitong kondisyon and dineclare mo siya ng tama sa application, Manulife will assess your case. Pwedeng i-approve na covered siya after 12 months, pwedeng i-exclude, or minsan pwedeng i-approve but may additional premium. Pero kung hindi mo dineclare tapos may findings pala later on, there's a chance na hindi siya maging covered. Kaya napaka-importante talaga ng honesty sa application. Kasi kung sakaling kailanganin mo yung benefits, ayaw naman natin ma-deny ang claim dahil lang sinikreto mo yung iyong condition. Now, baka tanungin mo, bakit kailangan pa ng waiting period? Well, simple lang. Insurance is meant for protection from the unexpected. Kung wala tayong waiting period, baka may ibang tao na kumuha ng plan after na silang magkaroon ng sakit. Tapos agad-agad gustong mag-claim. That would not be fair sa ibang policyholders na nagbabayad consistently habang healthy pa sila. Yung 30-day waiting period, pang-check lang yan if the client is already undergoing treatment. Yung 12-month waiting period naman, that's because some conditions take time to develop and are expensive to treat. So, kailangan i-manage din ng company yung risk. Kailangan talaga nating i-observe yung proper waiting period. So, kung healthy ka ngayon, this is the best time for you to get protected. Kasi once nalampasan mo ang waiting periods, covered na all the way. Renew ka na lang ng renew without needing to submit a medical exam. Okay? So, now, tumuloy na tayo sa exclusions. So, Medical Secure also doesn't cover procedures or treatments na hindi medically necessary. So, kung cosmetic surgery yan, like yung nose lift or for looks lang, or mga fertility-related procedures like IVF, hindi pasok sa benefits. Hindi rin kasama ang mga mental health conditions, mga treatments para sa obesity or weight loss surgery, routine eye checks, eyeglasses at LASIK. At para malinaw din, Injuries caused by war, terrorism, military service, reckless behavior, drug abuse, suicide attempts, or sexually transmitted diseases, hindi rin po kasama. Tapos kung ikaw ay mahilig sa extreme sports like scuba diving, motorsports, or mountain climbing, hindi agad covered yan unless na-approve ni Manulife beforehand. Again, ang mga exclusions na to are there to keep the plan fair and sustainable for everyone. And again, basta honest ka sa application mo, wala kang dapat ikabahala. Make sure you read the proposal for the complete list of exclusions. So, let's review and compare all three variants para mas malinaw. For basic protection, you have the 1 million pesos plan, perfect para sa mga average employees or freelancers. For broader protection, may 2.5 million pesos na plan. Actually, ito yung sabi ko nga pinaka-best-selling. And for top-level executives or those who prefer top-tier hospitals like St. Luke's or Makati Med, the 5 million pesos variant is highly recommended. Sa 1 million pesos variant, halimbawa, covered ang room and board up to 5,000 pesos per day. Pero sa 2.5 million pesos, mas mataas ang cap. And sa 5 million pesos, expect premium room coverage. Same with ICU, operating room, diagnostics, procedures. The higher the variant, the more flexibility and room for expensive treatments. I'm not saying na hindi ka pwede sa top hospitals. Kung 1 million at 2.5 million variants. I'm just saying na baka mabilis ma-reach yung cap mo sa mga expensive hospitals. So regardless of which variant or level of protection you choose, the inclusions remain solid. Inpatient hospitalization, emergency care, surgeries, professional fees, ambulance, ICU, even pre- and post-hospitalization. May kasamang annual physical exam, 24/7 teleconsultation, hindi lang pang emergency, pang prevention din. Okay? So, I have here QR codes for sample proposals. This is for you to have a visuals of the product details and terms. But remember, these are for a 30-year-old male. Pakipost na lang ang video para ma-scan nyo at ma-download. Dito naman, ito yung mga premium rates sa mga ages 30, 35, 40, and 45 years old for both gender. Lilinawin ko lang, these rates are for standard applicants. Okay? Actual premiums are based on age, gender, even occupation at time of application. Again, the older you get, mas mahal ng premium. I-pause nyo lang sandali para mas-scan nyo. Okay? So, also, if your birthday is within the next 6 months, plus 1 year na po tayo as our insurance age. Okay? So, kasigurista, tanong ko lang. Gusto mo ba ng 1 million pesos na health coverage every year or maybe higher up to 5 million pesos of coverage? Gusto mo ba yung tipong ma-admit ka sa hospital nang walang iniintinding babayaran, may annual check-up ka pa, tapos anytime na may nararamdaman ka, pwede ka magpa-teleconsult sa doctor? At higit sa lahat, gusto mo ba ng peace of mind knowing na kahit na may mangyaring hindi inaasahan, covered ka? If your answer is yes, then Medical Secure is the plan for you. So right now, you have 3 choices. First, if you don't see the value of Medical Secure, that's totally fine. You can go back to where you are and forget about this. Second, think about this. I'll give you 3 days to decide or discuss it with your partner or spouse. Bakit 3 days lang? Because health doesn't wait. A lot can happen in 3 days. You're healthy now, but anything can happen anytime. The goal is not to pressure you, but to remind you that the best time to get protected is before something happens. And finally, option 3. Let's do this now. Let's schedule a Zoom call so you can apply na agad. Don't wait until it's too late. I only need 45 minutes of your time to complete the application. Pero paki-block ng 90 minutes para masagot ko rin lahat ng tanong mo. And we can go through the process smoothly. So this could be one of the best decisions you'll ever make. Because you're not just buying insurance. You are buying peace of mind for yourself and your family. Again, my name is Jake Simeon, also known as Mr. Segurista. Let's protect your future while you still can. So please scan the QR code para makapag-apply na tayo. Thank you.